Here I'm going to show you the viscoelastic sandwich technique. Place viscoelastic above and below the dislocated complex. And if you do this properly, the viscoelastic will hold the dislocated complex. And you can actually remove both instruments and you'll see that the complex is now stable. Place viscoelastic below, this pushes any vitreous back, and place viscoelastic above, and this protects the corneal endothelium. And it's important to be mindful of the fact that the complex can certainly hit the endothelium, and you also want to be mindful that the complex can move posteriorly, and so the viscoelastic basically wraps around the complex and prevents both these things from happening. And as I said, if you do this properly, you should be able to remove both instruments and the complex can remain stable inside the eye. Now, of course, in vitrectomized eyes, you'll need to administer more viscoelastic, and sometimes that even then may not be enough because the viscoelastic will fall right back. That's why I find having the vitreous cushion to be a great supporter for these dislocated lenses. And so again, place viscoelastic above and viscoelastic below to create that space that will stabilize the complex. Now, it's important to note that you do not want to overfill above and below the bag because you may inadvertently cause intraoperative floppy iris syndrome where you have iris coming out through your main wound or through your paracentesis. And I always look at the biometry preoperatively to look at the anterior chamber depth. This really helps me determine how much space I have in terms of how much viscoelastic I'm going to use. If it's a small eye or a shallow anterior chamber, of course I'm going to use less viscoelastic, whereas in myopic eyes or eyes with a large anterior chamber depth, I'm okay to use more viscoelastic than I typically use. And so there is some merit in looking at your biometric data preoperatively as well, so you can avoid any potential iris prolapse. I hope you found this video to be useful, and thanks for watching.